But Naria has spoken a couple of times, so she has amazing things to say.
Hi, everyone. My name is Naria. I'm a functional gut health registered dietitian. So essentially what that means is I help individuals dealing with digestive issues. Now, today I want to touch on 3 different microbiomes. Now, the first one is going to be obviously the gut microbiome. Can anyone guess the other 2 microbiomes I'm going to be touching on today? I love that. I love that. So I want you guys to think a little bit bigger. So the gut is its own world. I want you to think, what other 2 worlds may I touch on today that affect our gut microbiome or vice versa? Any guesses? Oh, someone said it. Oral. Yes, oral. And then one more. Yes, vaginal microbiome. Yes. These these 3 worlds are very much connected. So if we're experiencing issues in the gut or reproductive health, it could actually have begun in your oral microbiome. So the first thing is, what is a microbiome? When we think of a microbiome, all that really means it's a little world in itself. And this world likes balance. For the most part, it likes diversity. So we want different types of microbes in there. We want different types of foods in there to feed them, for the most part. But there's one of the 3 that doesn't like diversity, and we're going to touch on that. Now, they like, I'm sorry? Yes. Now, think of these 3 worlds as they know their neighbors. For the most part, they don't want a lot of visitors. Think of if you're home and you're about to Netflix and chill, and then you have your lava cake, and then your auntie comes. It's like, auntie, I'm closing the lights here, buddy. I'm going to Netflix. Same with your microbes in these worlds. Sometimes you just don't want visitors. So we're going to start with the top one, the oral microbiome. Now, the thing about the oral microbiome is pretty simple, right? To have a healthy oral microbiome, floss 2 to 3 times a day. Brush your teeth 2 to 3 times a day. A dentist may say 3. I'm more flexible because I work with a lot of humans and I know how we are. But also little things like, how much are you drinking in regards to alcohol? Are you smoking? Because all of these things are going to impact this world that you have in your mouth. Very, very important. Now, after that, think, let's say we have a healthy oral microbiome, but we don't have enough stomach acid. So one of the biggest things I get with my patients is I go to the doctor and they prescribe stomach acid reducing medication, which at the right time for a good amount of period, it is very much beneficial. However, for most human beings, to take it for too long. So if we don't have enough stomach acid, even if we have a good balance of microbes in our mouth, they may pass to our gut. Does the gut like auntie coming? Now, let's say we're not flossing, we're not brushing, or maybe we haven't been to the dentist in 5 years, and there's all types of craziness going on. So even if you're not taking a stomach acid reducing medication, there's so much going on there that some of them survive the stomach acid and get to the small intestine. And again, does auntie, is she welcome? No, auntie needs to go back home right now. So with that is, we really want to think is, how is our oral health? Are we flossing? Are we brushing? Are we smoking? Are we drinking? Are we doing all those things? Because it could have started here. A lot of digestive issues I've seen, I've worked with over almost 10,000 human beings. Many times it starts in the mouth. So think, if I want to really focus on gut health, if you're using $50, $80 on probiotics, but you haven't been to the dentist, you're not flossing 2 to 3 times a day, do those things. Those are free, right? Most of us have insurance. Do that before you get a probiotic. So the first microbiome we talked about is the oral microbiome. That's its own world in itself. So brush your teeth, floss, go to the dentist, and so forth. So now we're scooting on down. We pass the esophagus, we're passing the stomach acid. Basically with the stomach, we just want enough stomach acid for it to break down foods and absorb nutrients and so forth. But now we're in the gut. So who when we think about gut health, what pops to mind for you guys? Junk food? Oh, what's good for the gut? Sorry. Fermented foods, yes. Anything. Fiber, yes. Fiber, if you guys have me on social media, I touch on fiber probably 30 times a day because it's really key. Your microbes will eat fiber. So, yes, fiber is key. Now, one of the biggest answers I hear is probiotics. So if I were to ask you guys, who's taking a probiotic, by the way? Yeah. Why do we want probiotics? What's the point of taking probiotics? The point of taking probiotics, even if we don't know the answer is this, friends, is to reap the benefits of the postbiotics. So microbes have jobs. We don't just want microbes for them to look disgusting, because they are, but we want them to do their job. And that's where postbiotics come into play. So we had a few speakers talk about hormones, immunity. I'm trying to think of other conditions: obesity, type 2 diabetes, fatty liver. All these things are connected to your postbiotics, what your microbes are doing and what they're not doing. So when we think about the gut demands a diverse world. We want different microbes in there. Those different microbes have different personalities. So maybe you like pizza, but then maybe your husband likes carne asada fries. And then let's say your husband brings carne asada fries and you're like, dude, I don't want carne asada fries. I want pizza. I, your microbes are the same. They have personalities. Some of them like red fruits. Some of them like green fruit. Some of them like raw, some of them like cooked. So when you think of all the microbes that are in your gut, you need a diverse diet. The only way you're going to have a healthy gut is by first, let's assume there's no digestive issues here. If that's the case, then the only way you're going to have a healthy gut is by meeting your fiber intake. Someone mentioned like 30 grams of fiber. I usually blast people with about 50 plus grams of fiber if they don't have digestive issues. And that's because I want to make sure that you're having enough fruits and veggies. My husband hears me talking the other day, and he's like, 50 grams of fiber, that's impossible. You would have to have a lot of fruits and veggies. Exactly. Load up your meals. Like I have bowls. My husband calls them, I may be saying this wrong, troughs, like pig troughs. Yeah. He's like, oh, you have your trough of the day. Yeah, that's right. I have like a big trough of fruits and veggies. And then I have my protein. Protein and fiber are going to be your best friends on this planet in life for so many different reasons. Protein or fiber, and that's it. If you're thinking about your 3 meals a day and you're like, what should I do for my gut? Should I spend $50 on a probiotic? How much fiber are you eating? Most people are lucky if they have 10 grams of fiber. So then we're questioning, why are certain cancers that are connected to the gut increasing? Well, how much fiber are Americans having? They're lucky if they're 8 to 10 grams of fiber. We need that fiber to feed those microbes. So kind of going back to the gut, the only way you're going to have a healthy gut is by, number one, focusing on, do you have a diverse gut? Are you meeting your fiber goal? Then we can go to other specifics. If you have digestive issues, we need to find out what digestive issues you have. Have you gone to the GI doctor? Have you gone to your primary care? Have you had the colonoscopy, endoscopy? Have you done that spiel? Have they outruled the big stuff? It is vital that you have to outrule the big stuff with your doctors. But if you go to the GI doctor and they're saying all the labs look good, you've had the colonoscopy, endoscopy, you're as fresh as it can be, but you feel like you're dying with brain fog and you're bloating and having diarrhea every day, well, I think we're not doing so well here, right? So that's where we go into functional testing. Functional testing has been one of the best things I've ever done in my practice. It really helps get to that root problem. Do you have leaky gut? Do you have IBS? What do you have SIBO, which is so annoying to treat and it's so annoying to experience? But do you have those issues? Because if you're going to your GI doctor, they're not going to find it. Even if they do a SIBO test, they're probably only going to test for 2 SIBOs. So when we think about the gut, if you don't have any digestive issues, you have to be meeting your fiber goal. You have to. At least 30 grams. I mean, after you go to 30, you should really bump it up to 40 to 50. There's really no limit unless you have digestive issues. If you've had surgeries before, then sure. But if you have a digestive issue like IBS or leaky gut, and you try to say, oh, I should have fermented foods and fruits and veggies, yeah, you should, but not yet. Your gut can't handle it, so you're probably going to feel very bloated and disgusted and so forth. So now the point is, for the guts, we need a diverse diet and we need a lot of different microbes so they can do their thing and we can reap the benefits of the postbiotics. That's literally the point of them. The only reason we want them, we're using them, is because we want them to create GABA. We want them to produce serotonin. We want them to produce GLP-1. How we're hearing about these GLP-1 medications. Where is GLP mainly made? In the gut. So when I work with individuals, they're like, Nari, I don't want to take your medications. Cool. Well, who's in charge of GLP-1? Let's focus on those little guys and let's boost them up. And that works really well. I'm not saying it's an overnight thing. Yeah, medications is faster. But we're gonna keep moving here. I'll stick here for hours. So now after the gut, we go to the vaginal area. That area does not like diversity. It's mainly ruled by the lactobacillus. And with lactobacillus, its job there is to keep it acidic. It doesn't like visitors. It really doesn't. Probably doesn't even like the husband. It's like, you need to get out right now. But it doesn't like visitors. So when we think about the balance there, the goal is to keep it acidic. And if we have an unhealthy gut, if we have an unhealthy mouth and everything just going down, translocation can happen because those areas are very close. And if it's not acidic enough, because maybe the amounts of lactobacillus aren't there, then everything's going to move along. And then you think, why do I keep getting UTIs? Why do I keep getting infections, even miscarriages? Why are all these things happening? If everything has been ruled out by your OB and your PCP and doing all that, then you need to maybe find a functional provider. It could be an ND, it could be a chiropractor, it could be a dietitian, it could be a nurse practitioner. There's so many of us that do functional medicine that go outside of the box and can really help you get to the root problem. That's really the goal here, to get to that root problem. It's not just masking it and saying, oh, take omeprazole and you'll be fine, or do this, or maybe you need antibiotics. Yeah, maybe you do, but what if you don't? And what are we doing here? If everything starts in the gut, how is your gut? I've gone to so many different conferences, I've heard so many different speakers, and if it has to do with obesity or diabetes or fatty liver or hormones, they all go back to the same thing. It goes back to the gut. So when I think about really healing my patients, I think, how's their gut? Because once we start to heal their gut, everything just starts to fall in place. Oh, Nari, I had brain fog before. It's just kind of gone now. I was so irritable before, but now I'm pretty chill. Oh, cool. How's your husband? Is he like happy now? Right? So everything is really connected. So if the only thing you get out of me talking today is that these three worlds are very much connected, I will be at peace with that. Think of, how is my oral health? How's my gut health? And again, if I don't have any digestive issues, you should really push for over 50 grams of fiber. Just eat more fruits and veggies, more beans. It's really just that simple. Replace some of your refined carbs with more fruits and veggies, because if you have your refined carbs and fruits and veggies and protein, trust me, you're not going to have room. You're not going to have room. But these worlds are very much connected. So if you're like, I don't want to spend $50 on a probiotic, cool, just focus on fiber. That's something you can do. Just go to a grocery store. You guys are already going to the grocery stores anyway. Just add more fruits and veggies. But these three worlds are very much connected. If you haven't had answers, I really do recommend that you guys look into functional medicine and possibly pair functional medicine with Western medicine. Integrative medicine honestly works so good with a lot of the patients that I work with. And yeah, that's the spiel for the day.